So, higher intake of this can reduce our risk of Alzheimer's dementia. This is so important. And I remember years ago in medicine, we would always ask our senior patients, are you on B12? Are you taking your B12? And I feel like it's kind of getting ignored now. Let me know. Has your doctor, your practitioner asked you, are you taking your B12? Are you eating foods rich in B12? And also, if you're vegetarian or vegan, I've got bad news for you. So let's go over how you can dramatically reduce your risks of dementia. And did you know in certain studies it showed that if you test low in B12 on lab work, your risk of dementia can go up as high as 40 and sometimes even 50%. And it's really easy to treat, and you need to know about this. So let's get into the information so you know exactly what to tell your doctor, your practitioner, and you know what to do now. So we know that B12 deficiency is strongly associated and correlated with cognitive impairment that contribute to signs and symptoms of dementia. Low B12 levels can lead to cognitive dysfunction, memory loss, confusion, balance problems, and even that numbness and tingling. Like if you've ever heard of the term a Charlie horse, yeah, low B12, numbness and tingling. So these symptoms overlap with actual Alzheimer's disease. Now, that is a little bit different. That's when we have an abundance of basically trash building up in the brain. It's these little tangles that we get inside. They're called tau tangles inside the brain cell. And that's why I love sunlight, because sunlight has infrared light that can penetrate deep into our skin and possibly even the brain, especially if it hits your eyes, to help dissolve tau tangles. And that's why I love infrared light therapy. That's why red light therapy has really taken off. But back to B12. So severe cases of low B12 or B12 deficiency can lead to dementia, but it's reversible. That's the good news. This is all reversible. So if you have a loved one or even you are suffering from any of these symptoms, yeah, you can reverse it. So research indicates B12 has a protective role in the brain to guard against neurodegeneration. That means just like a brain that's falling apart, right? So yeah, higher B12 intake can reduce the risk of Alzheimer's disease. Lots of studies have shown this. So while not every case of low B12 directly leads to dementia, it is an important factor in cognitive function. Okay, so let's talk about the blood tests you need to know about. So testing for B12 does involve its blood tests. We need to do a serum B12 level. But it's also very important to get what's called a CBC in addition to the B12 test, because the CBC is looking for what's called macrocytosis, also known as a large red blood cell. When I see that on a CBC, I'll tell the patient like, oh, you have macrocytosis. It probably means you have low B12. And then we dive into that. But it's really important to have another test alongside B12, and it's called MMA, and that stands for methylmalonic acid. I also test a homocysteine level as well, because if you have elevated levels, it's usually going to mean a B12 deficiency. Elevated MMA. So when you see a high MMA, that does mean you have a B12 deficiency. And that's where the confusion lies. It's like, oh, okay, one of my B12 tests is MMA. It was high, I'm fine. No, it means you're deficient in B12. I tried to explain that to a patient a couple of years ago, and she was like, well, my brother's a doctor and he says I'm fine. I was like, okay, I'm not getting involved in that. But no, you are low in B12 if your MMA is high. Okay? So if your serum B12, back to the B12 test now, is below 200 parts per mil, then that is a warning sign. Okay? So I'm not going to go over the statistics in the population, but we just know the elderly is more at risk. And why is that? Because our gut changes. You know this, right? So those of us that are almost, well, I'm going to be 60 in a couple years, so I'm almost elderly. So we face higher risk of B12 deficiency because our gut changes. We get what's called atrophic gastritis. So that means the stomach acid is reduced in our stomach. We're not making as much stomach acid, so we're not breaking down food appropriately, and we're not absorbing B12 through food like we did in the past. Malabsorption affects up to 20% of those over the age of 60, all the way up to age 75 in that percentage. The percentage goes higher after age 75. So there's also medications like metformin and proton pump inhibitors like Prevacid and Prilosec that make the risk of low B12 go even higher. And so my patients that are on metformin, I always lecture them on make sure you're getting your B12, right? But I don't prescribe Prilosec or Prevacid just because I know how important stomach acid is. And those of you that maybe just underwent surgery or there's something else going on, like maybe you're being treated for H. pylori, and in the short term, you need to be on a PPI. Okay, that's fine, but you got to watch your B12 levels, right? So, because the consequences of this are severe, the impact of not watching your B12 and not having adequate B12 intake, which we'll talk about here in just a second, can lead to this. We've got neuropsychiatric symptoms. So depression, paranormal, so used to talking about that, paranoia, memory loss, incontinence, and dementia-like decline. I mean, that is my worst fear, honestly. Like, I don't ever want my patients or myself to ever suffer from dementia. So you've got to get screened for B12. All right, so let's talk about the foods now. Now, that's why I said, vegetarians, you're not going to like this, but foods high in B12. I don't like personally all these foods, nor do I recommend them, but let's go through what foods are high in B12. Clams, liver, sardines, beef, salmon, which I do like, tuna, eggs, milk, dairy milk, fortified cereal, which I'm not a big fan of, and nutritional yeast. So vegans and vegetarians are like, oh, I've got to be low in B12. Yeah, that's why this is important. So you want to have your B12 checked. Now here I have an image here. We have, like my patients are usually on the injectable form of B12 because it gets right into the bloodstream. And I prefer methylcobalamin because I have a lot of patients with MTHFR. But there's also B12 supplements, and over the counter, patients can find methylcobalamin, but the usual kind you find is hydroxycobalamin, which if you have MTHFR, you may not absorb that type. So that's important as well. Folate is very, very important too, but I wanted to keep this just limited to just plain old B12 right now and how that is so important because a lot of times patients are misdiagnosed, like, oh, they have dementia. We're going to start putting them on Mellaril and Cogentix, and we're going to put them in a care home. You know, we're going to put them in the locked unit where we put the dementia patients. But have your loved one or yourself tested for B12 first. That's how important this is. And you know what they don't talk about in the mainstream information about B12 is how important B12 also is for our bone health, and especially as women, you know, when we face menopause and all the symptoms with that and we lose our bone density, B12 is so important for preserving our bone health. That's another one too. And plus I love it for thyroid support and energy. It's so, I mean, it is really used in so many processes in the body for even creating energy like ATP. So hopefully this was really educational. Now you can talk to your doctor or practitioner about this. Comment below if you already knew about this or if this was new info for you. Thank you for joining us here at Vitalize Health Partners. I'm Dr. Andrea O'Connor, and we also have health coach Erin. She has fabulous information on this channel.